Okay, so in a bid to bring health and nutrition services closer to all Filipinos, the Health Department launches a new campaign, which is called A Promise Renewed for Kalusugan Pangkalahatan. And now to tell us more about that, we have in the studio Health Undersecretary Ted Herbosa. So thank you so much for joining us this morning, Ted.
Good morning, Evelyn, and thank you very much for inviting us and talking about universal healthcare or
Yes.
Kalusugan Pangkalahatan.
Now, tell us briefly, what is the APR Kalusugan Pangkalahatan, or A Promise Renewed for Kalusugan Pangkalahatan?
The promise really of the Aquino administration was to provide healthcare to everyone. When this administration came in, there were statistics telling us that almost 4 to 6 people die out of 10 die without even seeing a doctor. So the challenge of Secretary Ona at that time was really to provide health care to all, to everyone. So that's what we call health equity. We have health care in the country, very good health care in private hospitals, but we have overcrowded government hospitals. So the idea of universal health care was to provide equitable distribution of the health system. So luckily we have the health insurance, the National Health Insurance System, which is PhilHealth. So we built up on that. And what we did was we raised funds so that the poor will be enrolled. In our first 2 years, the president was able to budget for us about 12 billion pesos to enroll about 5 million families, the poorest Filipinos. But as you know, our incidence of poverty is way above that.
Yes.
So we fought very hard in 2012, and we got a higher levy or tax on cigarettes and alcohol.
All right.
And in 2013, we raised quite a sizable amount, about 42 incremental amount. And 85% of that budget was put in the 2014 budget, this year's budget. And this year, we're now allocating about 35.7 billion.
So this is how much is the increase compared to our past budget for
65% increase from last year's, from 2013's budget. So we're one of the agencies with the highest. So we technically have achieved universal health coverage for our poor. Because today, the budget, as I said, 35.7 billion pesos can pay for the health premiums of 14.7 million poorest families. So that's about 45 to 50 million people already,
so
if you
with
count
that,
their children.
What can they get now, which they previously probably would not be able to avail of?
Previously, these people would just go to a public health facility to try to get free health services. But in the past, because the government budgets were low, they wouldn't get it free. They'd be asked, the medicine may not be available, the test may not be available, and they end up going to a private center and paying out of their own pocket. So, but now we're trying to improve this, because not only did we spend about 35 billion for insuring people, poor people, we also spent in the past 3 years about 30 billion trying to improve government health facilities. And not only DOH health facilities, including facilities in remote areas, rural health centers, barangay health centers, district hospitals. So we're trying to improve and make sure that they have equipment and facilities, laboratory testing equipment, so that our people, especially the poor or in the remote areas, when they go to these areas, they can actually be able to have access.
Like what can they, for example, diagnostic tests that they can get?
Well, we've been
from
buying a lot of this imaging testing from ultrasound to X-ray to CT scans in the hospitals. And we've also been refurbishing a lot of the rural health centers, so it becomes even more, pleasant for mothers to have antenatal visits.
That's right.
For children to get their vaccinations. For people with TB to actually get free medicines in these areas. And many, many more. So even dental services. We even place nurses and doctors to the barrios.
These are free.
These are free. This is now free. What has happened now is that if you are part of the sponsored program, part of those paid for in this sin tax revenue, the health insurance premium, you're called a sponsored PhilHealth member. That means you're really poor. We follow a list done by the Department of Social Welfare. Those who are poor. And if you're poor, you're called a sponsored PhilHealth member, and you get more benefits than a regular member. You get what's called the primary care benefit package. That means all your consultations in the health center and the hospital will be free. You don't have to pay anything. If you get hospitalized or your family gets hospitalized, you get what is called the no balance billing policy of the Department of Health. That basically means the public hospital cannot charge you. They will just charge PhilHealth. So they will have to treat you, give you all the medicines, and then...
This is regardless of the disease that you may have.
Regardless of the disease they may have.
So if a person has cancer, for example, or what you call the catastrophic cases,
that's another package. And the catastrophic illness package is available to all PhilHealth members.
Okay.
So regular members, lifetime members can avail of what is called the catastrophic illness package. These are packages that, you know, if you get sick of these illnesses, it will economically devastate your family income. They say if it will eat up about 30 to 40% of your yearly family income. It is a catastrophic illness.
Yes.
So we included leukemias in children. So the chemotherapy for that allows for cure. So what happens is that PhilHealth is now paying out about $180,000 for the chemotherapeutic drugs for children in leukemia, so that young children will have a chance to get cured of leukemia. Breast cancer in women, we're paying out about $180,000 for the whole diagnostic, from the mammograms to the operation to the chemo or radiotherapy that they will have. So that's a big boost to all the women who cannot afford breast cancer care. For men, there's prostate cancer. For heart disease, we are already paying out for coronary artery bypass and also for congenital heart disease.
So the coverage now is getting wider and wider.
Even transplantation for those with renal disease, and it's like 500, 600,000 for those last two illnesses I mentioned. So it's a big help, not only to the poor, but also to the middle class.
Yes, to everybody who avails of the PhilHealth or these health services or universal health care of the government. Now, I understand that you are, because of this, you want to further increase the information on this particular project.
Correct.
So what are you doing
That's
now?
the idea of the A Promise Renewed, because we realize that even as we increased membership in PhilHealth to almost 90+%, we realized that in the hospitals, very few are using their PhilHealth benefits. So we said, why is that? Because many people don't understand what a PhilHealth card is, or many people who are already listed in the PhilHealth membership don't know they are even members, especially the people who are very poor in the remote areas. So we're out on a roadshow to go from town to town, from municipality to municipality, and really educate the people about PhilHealth. Even some doctors are not really informed about how PhilHealth works and operates. We'd like to give all these new benefits, from case payments, no balance billing, catastrophic illness, primary care benefits. We want the people to understand about health insurance. I guess you're educated, you pay for insurance for your family, because you really know how much it would cost if your family member gets hospitalized. So this is a change from the previous concept of the poor, where it's a patronage type. They will go to either a philanthropist, the church, the politician, or some rich hacendero that will pay for the hospitalization of their family. Today, we're offering these services to everyone. So it's a little change in mindset. So that's why we're having this program for Roadshow, and making sure that everybody understands that they are a PhilHealth member and they demand it. They demand health care from the public health facility. That I'm a PhilHealth member, so I should get equal care, the same care as you'd give a paying member, because PhilHealth will pay for my health care. So, number two, what are the benefits and what can I get out of it?
So you'll be having all these caravans and roadshows for the entire year to promote this.
Yes, and we really thank you for allowing us to also talk about this, so that a lot more people will be informed. Even middle class people sometimes don't understand what the PhilHealth is, and they don't realize what that deduction is about 100 pesos a month. That actually insures their whole family, their spouse, their children, below 20 years and
old,
their parents
who are above 60 or
60
something like that,
are now covered with PhilHealth, so that when they enter any hospital, the hospital, whether private or public, can actually charge PhilHealth a rate, and they should deduct that in their total bill, so they should see that. And that's only a total of like 2,400 pesos
a
year for a whole family. So that's really very small for all the benefits I mentioned.
Well, thank you so much for sharing with us that information, Usec Ted Herbosa. Thank you so much, and good morning to you.
Thank you, and good morning to you also.
That was Health Undersecretary Ted Herbosa telling us about the Health Department's new campaign.